about socialized healthcare?
I do not like the idea of that.
I don't want the government picking what I can and cannot do.
Well, my husband's from Europe, so I think it's pretty good, actually. I think a lot of people are covered by it. Everybody's covered. They don't have to worry about paying for it.
It's definitely more accessible for everybody. It allows all of us to remain healthy, to live long lives as much as we can.
I think it's kind of a necessity that the government provides health care for its citizens.
If everybody has something for free, who's going to pay for it?
Okay, what if people pay for it by taxes? What do you think of that?
Well, that's going to increase. Do you like to pay taxes?
So first of all, let me ask you, do you know what the NHS is?
No.
They regulate and provide national health services for the UK.
What do you think the average copay is under the NHS?
I can't imagine it goes any lower than 30.
The amount for me is like $120 to see my family physician.
And so based on that, what would you guess would be the price there? Similar?
Probably, I would say probably higher.
Higher?
Mm-hmm.
It's actually, there isn't a copay, so it's $0. Do you know if you get healthcare if you're not a citizen, do you think, under the NHS?
Isn't there certain protections, but not all of them?
You actually do get healthcare if you're not a citizen. What about if you're homeless?
Yes.
Correct. What about specialized costs, or specialized care, like an inhaler or an EpiPen?
In the UK, for an inhaler or prescriptions, and I'm just guessing, at the most $20.
I'm guessing UK doesn't pay anything, which really sucks because we pay a lot.
I would say it's probably higher.
Considering what it costs here, I'm going to ballpark that at also another 25-ish.
Okay, it's actually £9
Just 9.
for any medication, which is about $12.
Okay, so they are cheaper.
So they are cheaper. What do you think of that?
I am still for individual medical care.
So have you ever avoided seeking health care or treatment or medication or any sort of health service because of the cost and you're worried about having to pay some sort of fee?
Yes, I have experienced that a lot with patients that come in with pneumonia but have been at home for a matter of 5 days and came in when it got worse and had to be admitted to the hospital. And we're like, why didn't you come in sooner? Well, I couldn't afford this bill, so I was trying to take care of myself at home first.
Even just at school, I know people who, let's say, don't have the student health insurance plan, won't go get, let's say, like contraception or things like that because they don't really want to pay for it out of pocket.
I found out later that I had sprained my ACL. I couldn't move, but I also didn't want to call an ambulance, so I couldn't afford it.
So what'd you do?
I got on my friend's back.
But my sister, she has a lot of allergies, so instead of using the ambulance for her anaphylactic allergies, we had to drive her, which is very scary because you don't know about traffic or anything. You don't have the same privileges as an ambulance on the road.
Have you ever not sought treatment because you're afraid of a cost?
No, ma'am.
Do you know anyone who has?
No, ma'am.
What about people who are afraid of the cost of, say, an ambulance?
Okay, that happens all the time because we have so many Americans that don't want to go in debt and they're trying to save money and they think they can go buy a car instead of an ambulance.
So what would you think if that service was free?
If that service was free, anything that's free, sometimes it's not worth having.
%77% of people in Britain support the NHS and are happy with it. Would you say that you are happy with the United States healthcare system?
No. Definitely not.
No, and I'm actually pretty lucky because I work for the university, so my insurance is pretty good, and even then I'm not happy with it.
That's a loaded question. I have insurance, and it's good insurance through my husband's company, but we pay through the nose for it. If it were free, I would love that. And if we only paid $350 a month, that would be a huge deal.
I don't believe that our government should be responsible for providing all of us health care. I think the individuals need to be responsible. They need to have a job. They need to look for jobs that provide benefits.
There's so many people, especially people from sort of like lower socioeconomic backgrounds, who can't get the health care that they need because they just can't afford it.
The premiums are still pretty high. They're not unreasonable, but they're still pretty high. The medicine I have to pay for is not covered that much, and it's not even anything crazy. It's literally allergy medicine. And I still have to pay a fair amount every month for just allergies.
People are more than numbers, and they're more than, the change that you make from, stiffing people out of their health care.